So good evening, everybody. Apologies for last night. Jeremy Hunt's my name. We had a few technical problems getting on live, but so we've rescheduled for tonight. And what I've been asked to sort of talk about is going to be options for sort of body contouring after massive weight loss. So we have a bit of an increasing interest in sort of massive weight loss surgery as more and more people have had bypass procedures and lap bands and gastric sleeves. There are more and more patients who have now gone on and successfully lost that weight, and they're now coming online for options for body contouring. And the options are going to include options for contouring of the abdomen, potentially contouring of the breast. There are options for contouring of thighs and contouring of the arms. So that we as plastic surgeons are offering a number of different areas that can be improved upon. And what we're sort of looking for is to, allow patients to, reap all the benefits that they've earned by losing all of their weight. So the weight has been removed, but a lot of patients are still troubled by the excess skin. And for that reason, they're coming to us seeking an opinion as to options and ways to potentially go on and improve the quality of their life by unburdening themselves of the excess skin. So we will see patients and we need to put together tailored options for people to try and get them the best results possible. So it really does come down to individualizing care, and what we will do is sit down with patients as individuals, and they'll obviously express an interest in particular areas. We'll then formulate a surgical plan, and we want to try and deliver the best results we can with the minimum sort of surgical interventions and the minimum amount of downtime for patients. But we've got to be very careful to make sure that when we do it, we absolutely do it safely, so that there's no compromise in patient care by people trying to do too much surgery in one sitting. And that's something that's very, very important, and it's very, very difficult sometimes for the patients to come to terms with the fact that they want all of the operations done in one go, but sometimes that is not necessarily in their best interest. So it does fall to the patients. As doctors, we need to listen to our patients. The patients also need to listen to the doctors, because the doctor's advice will always be in the patient's best interest, so that we're trying to get the best outcome possible for our patients. So I've been forwarded some questions from some patients already, and some of them revolve around swelling and how long swelling will persist after somebody has potentially a tummy tuck. So specifically, someone's asked about swelling after a tummy tuck some 6 weeks down the line. So from our point of view, that's not particularly unusual. So at 6 weeks, we're going to be happy to see a degree of swelling. And the difficulty is for the patients that when they're in an upright position, the swelling is going to move down with gravity. And for that reason, the swelling tends to get stuck at the level of the abdominoplasty or tummy tuck incision. And that's where patients often describe swelling. When they're in bed, they're in a horizontal position, so quite often the swelling and the bruising is at the back and on the flanks. But once people are up and about, well into the 6 week mark, the swelling just moves down with gravity, and they find they often have a little pooch over the top of the scar. That's not uncommon, and the real answer is that it's going to be fluid that's in the tissue that's heading downwards under the effects of gravity, but basically it's just getting stuck at the level of the incision. And with time, the body will learn to sort of bypass the incision and drain that fluid, but it does take time. So that if you do get online and you start looking how long does the swelling last for, sometimes it can be months, and then it can, in some instances, it can be quite a number of months. So patients, really, we will caution them that even if there is swelling to even out to 6 months or 12 months after a procedure, we're still optimistic that that's going to get better with time. So I think the trick is when patients are worried after their operation, they just need to stay in touch with their surgeon. They need their surgeon to review things, and then with time there'll be there'll be an intervention if it's needed by the surgeon, but in most cases your best friend is going to be time and patience, and that way we just wait to see the final results. So I've got a comment from Crystal, thank you, just mentioning again that, the dreaded cankles came after a tummy tuck, but I would expect that would be for a while. And again, it's that fluid just heading south, and the body is basically under the effects of gravity, so that all fluid, and I tell my patients that after an operation, your tissue is like a big wet soggy sponge, and if you hold the sponge upright, all the fluid will move down to the bottom, so that patients do quite often get swollen thighs, swollen ankles, and with time the body has mechanisms to clear that fluid. It's just like when you get off an aeroplane after a long flight, you quite often find there's fluid in the ankles, but as you walk around, that fluid's going to move, it's going to be redistributed through the body, and the body will learn how to balance that excess fluid. But it can be weeks, and sometimes it can be months. So other questions I've been asked about are about compression garments, and the compression garments after body contouring are to try and minimize that swelling, so that if we can minimize the amount of swelling and the amount of fluid that gets into the tissues, then the patients have a better chance that fluid will clear more quickly. So the compression garment offers a number of advantages. It's going to be a case of prevention is better than cure in terms of stopping swelling, so that we don't have to then wait for swelling to resolve. So that has that benefit. Patients often quite enjoy the feeling that things are held in place, so that patients get reassurance that after the operation, particularly if there's some numbness in the skin, that everything is comfortably snugged in the right place. And some patients will like to wear the compression garments for a longer period than I would see as beneficial in terms of fluid, but it's beneficial in terms of patient comfort and patient confidence. And I'm happy for the patients to wear the garments as long as they possibly feel comfortable wearing them. And then patients don't need to stay in, strictly speaking, surgical compression garments, so that after surgery, we're looking for a garment that's, it has quite a high compressive force, and they're often quite rigid and they're often quite uncomfortable, so that after a couple of weeks, it's quite reasonable to step down to a less aggressive garment in terms of how stiff and compressive it is. And there are lots of products available in terms of, formwear and Spanx and those sort of brands that are totally appropriate to wear after, body contouring surgery. And they're often lower profile, more flexible, so they fit underneath clothing far more comfortably. Now, there will be times when, we may choose not to wear compression garments after surgery, so that in some patients, if we have concern about the degree of blood flow into the tissue, if we have concerns about wound healing, we may be inclined to leave those compression garments off, because although they provide compression on the tissue, the compression on the tissue can then lead to a decrease in blood flow. So there will be times where we decide that we don't want patients to wear compression garments for a period after the operation. And that sort of decision is often made at the time of the operation, so that, nothing in surgery is absolutely fixed. That's the biggest trap in surgery, is to have a fixed, inflexible plan. You need to be able to, modify the plan based on how the operation is unfolding, so that, walking out the door on a sunny day means that it may not start to rain later, and you may need to get the umbrella out. So that you need to have a degree of adaptability to be able to take on the changes that can occur in an operation, so that those decisions are often made during the time of surgery. So another question that I have been asked about is about dressings after body contouring surgery, and different types of dressings, and each surgeon will have a level of comfort with different forms of dressings, and then in certain instances another type of dressing may be more applicable. And the one I've been asked about is the one that contains silver. So that silver, we have long known, is sort of an antibiotic or an antiseptic in a way, so that in wounds where we have potential infection, then a dressing that contains silver is going to be beneficial in terms of treating that infection and then allowing that wound to heal. So that the silver dressings are helpful in certain circumstances, but then in other instances they are no better than a standard dressing. So that, again, it's going to come down to surgeon choice as to their preferred option for dressing, and then applying the surgeon's choice to the individual situation, just to make sure the patients are getting the best outcome or the best results possible. So that there are many, many different dressings, there are many, many different surgeons, and there are many, many different patients, and it's all about putting the combination together to get the best outcome possible. So one of the biggest questions I get asked, and one that was asked of Trish at Plastic Surgery Hub, is after weight loss, does Medicare recognise the need to do surgery? And it does in certain instances, and those instances where patients meet the requirements of Medicare to qualify for the procedure as one of medical need. And Medicare's definition of medical need is going to be where a patient has lost a certain amount of weight, where they have then generated a certain laxity to the skin that then potentially creates skin on skin, skin folds, skin infections, and then potential health problems. So Medicare's definition of when you become eligible for a cosmetic, or when you become eligible, for a medical body contouring procedure, is when you've reduced your BMI, or your body mass index, by 5 points. So the BMI is going to be a ratio of your height to your weight. So there will be a certain number that everybody carries, and then that number puts you into a classification, be it obesity, be it overweight, be it healthy weight, or underweight. And those numbers carry numbers such as 35 for obesity, 30 for overweight. And then if you've reduced your number by 5 points, then you potentially qualify for a Medicare item number. And that then means that Medicare will recognise the procedure, which then means if you are in a private health fund, they are sort of honour bound based on the level of your insurance to recognise that medical problem. And then they will cover costs such as hospital costs and operating theatre costs. So it is a little bit complicated, but it comes down to a medical practitioner assessing an individual patient to see if they've then qualified on medical grounds for the Medicare item number, and then that patient having a level of potential private health insurance that covers that Medicare item number, means then that costs such as hospital and operating theatre will be covered. So breast surgery, though, was asked in the same question by this patient, does not come under Medicare in terms of being eligible based on weight loss. So that a breast lift or a breast reduction will be recognised by Medicare if it is for functional reasons, but those functional reasons are not tied to the patient's weight loss. And again, it comes down to the patient sitting with the doctor taking a history and an examination, and then deciding in each individual case if the patient is eligible for a Medicare item number on the basis of a breast reduction. If they are, then Medicare will recognise that procedure. And again, the health fund, if it's in place and the item numbers are covered, would cover hospital costs and operating theatre costs. Another So when it comes to body contouring, I tend to think about, I think about areas. So I think about, each operation that a patient has is going to drain a certain amount of their reserves, and it's going to take a certain amount of protein, a certain amount of vitamins and minerals to heal the wounds and recover from the procedure. And really that's the basis for why we need to be careful about how many procedures we're going to be able to perform at the same time. Because if you run out of proteins to heal and vitamins and minerals when you're still recovering from surgery, then you leave yourself open to wound complications and potential wound infections. So that patients do need to potentially stage operations. And then I will stage operations based on anatomical areas. So I tend to think about the abdomen, hips, and buttocks as being a unit. I then think about the breast and the arms and the back as being a separate unit, so that there's almost a line that goes there's above the tummy button and then there's below the tummy button. And for me, that's where I will go. I can do one of those areas in a single operation, and I can be confident the patient will have the reserves to heal from that procedure. And then if they need the other area addressed, I'd like to do it as a separate procedure. So you need then to wait an appropriate amount of time after the first procedure for the body to recharge its reserves and its fuel, so that we can then potentially heal from a second operation. So in my practice, that can be, and it can be anywhere from 6 weeks to 3 months or 6 months, depending on how big the procedures are, the age of the patient, and then any other background medical problems. So that patients do need to be mindful that we don't stage things because we want to drag this journey out for them. It's because we want to get them the best result we can in the shortest possible time, but most importantly, do it as safely as possible. So someone has just asked a very good question about doing something that is recognised by Medicare, such as a tummy tuck, which potentially does, if they qualify, get a Medicare item number. Are you then able to do breast lift and breast implants at the same time, even if it's not covered by Medicare? And yes, you can combine medical and non-medical procedures. Your health fund and Medicare would potentially recognise the costs associated with the medical portion of that procedure, and then the patient would then need to cover the expenses and costs for the non-medical portion or the cosmetic part of that procedure. But it's not unreasonable to again combine breast surgery and tummy tucks, because patients, generally speaking, will be able to recover from that combination of surgery quite comfortably. It can be done confidently without compromising the results of the breast surgery or the tummy tuck. And it has the huge advantage for the patients that they can go to surgery once, they'll have one surgical procedure, one hospital stay, and then one potential recovery time. And for patients, that's quite important, because it's part of the cost for an operation for patients is going to be the time that it takes to recover. So trying to keep that as minimal as possible is quite often to the patient's advantage, because there's less time off work, there's less time that potential family members need to then take off work to support the patient, less time that the patient needs help around the house. And all in all, it comes down to, as I say, putting the right combination of procedures together for the right patient, and then just making sure it's done once, done properly, and done safely. So another question that's been asked is the area of the mons pubis, and whether that can be addressed at the same time as a tummy tuck. And in my practice, I do regard that as part of the tummy, really, and that it is always part of a tummy tuck. So for me, contouring of the tummy is really about, the abdomen, the flanks, the thighs, and it needs to be something that's considered more almost circumferentially than just the tummy, because I think, generally speaking, my patients want contour. That's what they're after. They want body contour. And for me, the lower body part of it is going to be the tummy, but part of it certainly is the mons pubis, and part is the hips and flanks, and then part is going to be the thighs, and part of it is the buttocks. So that I talk to my patients a lot about the different options that can be associated with a tummy tuck, and just making sure they have all the options available to choose from, so that they make the right choice in terms of getting the best outcome possible. So we'll talk about mons pubis reductions and elevation. We'll talk about improving the inner thigh by using the tension generated by a tummy tuck to lift the thigh up. We definitely want to avoid dog ears at the end of the tummy tuck, and that's quite often arises when patients will be better suited with an extended abdominoplasty that really addresses the excess in the flanks. And then as we go around to the buttocks, if there's ptosis of the buttocks and we need to elevate the buttocks, then we can consider doing that at the same time as the tummy tuck. And then we're into the area of what we call a lower body lift or circumferential surgery. And then everybody has sort of come to terms with the fact that a lower body lift will create a flat buttock. So we will use, in my practice, we use the tissue of the lower back to then almost post in and double breast to do a buttock augmentation, because I tend to think that, for my female patients, they want to look good in a tight black dress. They want to wear a little black dress, and that's really what they're after. So there's not much point in my eyes creating a flat tummy that has bulges and dog ears at the end of it that are visible under that black dress, because ultimately all the scars from this surgery are going to be located under a pair of bikini briefs, and really we're looking, as we call it, body contouring. We're looking for contouring of the body. So it's really about patients being informed as to what's available, so then they can make the right decisions. And if they are making the right decisions and they're on the same page with the surgeon, then the result should be, predictable. And then a predictable result creates happy patients. So I have been asked a very good question: what are dog ears? Dog ears are maybe they're a surgical term where if you pinch two triangles of tissue like a tummy tuck, at the end you might get two little triangles sticking out, and they're often what patients are going back for revisions of tummy tucks for, because they're nice and flat at the front, but there's almost like a little poochy triangle on both the sides, and they're something that give patients a lot of grief. And it then means to revise it is a second surgical procedure, which is not in the best interest of the patient. So, and it's one of seeing that problem arising before the first operation, explaining it to the patient, and then explaining that to address the problem they may need a longer incision, but that incision again will be located underneath bikini briefs, so it won't be visible, and the benefit will be that they don't have that sort of wider, blockier look after a tummy tuck. I've been asked if it's going to be better in terms of healing to stagger procedures. I do tend to think about the body as we're going on a bit of a surgical trip, and there's a certain amount of petrol in the tank, and we better have enough petrol to head out there, turn around and get back again, so that I'm happy to put procedures together as long as they don't drain too much petrol out of that tank and we end up stalling the car halfway home, because then we're in all sorts of trouble. So that I do tend to combine procedures. If I don't think it can be done safely and confidently, then I will stagger those procedures with intervals between them, so patients can, refill the tank of reserves with, a good healthy diet. But I do think that each patient is going to be individual, so that in some instances it would be appropriate to combine, potentially a form of breast surgery with a tummy tuck, or breast surgery with a lower body lift. But in other patients of a different age group or with other medical background problems, it probably wouldn't be an appropriate combination of procedures, because it does put a further stress on the patient's reserves to heal the more surgical intervention we do. And quite often when you do hear about procedures that have not gone well, it's going to be where maybe one too many surgical interventions were undertaken in the same occasion, and then everything tends to cascade and we get into all sorts of problems. So we do like to combine procedures for patients' convenience, but we do need to be mindful not to overdo it, because we will create more problems than it's worth. I've been asked about putting scars in the correct position with abdominoplasties, and of course we do want to put the scar below a pair of briefs, and then it's going to come down to what style of brief different patients then wear, and then what's going to technically be possible given the amount of spare skin they have and where they want that scar to be placed. And then patients also need to be mindful that what may be in fashion this summer in terms of a certain cut to a swimwear line may not be in fashion in a year or 2 years' time. So that we do want to keep scars from tummy tucks as low as we can at the front, and we want to position it somewhere around about the level of a cesarean scar incision. We then want it to come up and sort of up over the ridge of the hip bone, and then if it goes around the flank, it needs to stay low, so it's staying below a pair of bikini briefs. And if we're talking about a lower body lift or something that's circumferential, then it does need to stay above the crest of where the buttocks are, but not so high that it then rides up above a pair of jeans, let's say. So there are some techniques to positioning the scar. There are then some techniques to ensuring that where you do position the scar at surgery means that it's going to stay at that level. And it really does come down to where the patient wants the scar, what tissue the patient is giving the surgeon to then work with, and then employing the right techniques to get the best results possible. So it is possible, and we do like to put scars certainly below a pair of bikini briefs in women, and for me below a pair of speedos in men. So that and that's then two totally different sort of locations. So we need to be mindful that male fashion and the male body is one surgical plan, and that female fashion and the female body is a different surgical plan. The one thing that seems more consistent, though, I must admit, is that male fashion in terms of swimwear is more standard, whereas female fashion, the height at which a pair of swimwear briefs goes over the hip changes constantly. So patients need to sort of understand that we're looking for the best possible match we can come up with. But I have been asked about revision surgery, and when is revision surgery appropriate. Revision surgery is, it's always a potential that is in every practice. So that if you do enough operations, there will be one where the outcome is not what the patient wants, and it's certainly not what the surgeon wanted. And when those two meet, then it's a case that potentially warrants revision. The difficulty is going to be where patients don't get the result that they thought they were going to get, and that it may be a case where a surgical revision is not going to improve that situation. And that's one where there needs to be a lot of dialogue before a surgical procedure to make sure that the patient and the doctor are on the same page in terms of results, that everybody understands what the outcome is most likely to be, so that when the outcome is not that, there's a clear understanding that something has not gone as well as the patient wanted or as well as the surgeon wanted, and then it's time to consider how to improve that situation. And then sometimes early after an operation, the best plan will be time, and time alone often improves those situations. Wounds need time to heal, wounds need time to fully mature, and at that point, it's time to consider surgical revisions. And that will be a point that the patient and the surgeon will need to have an understanding of, so that depending what the revision is and depending what the procedure was, sometimes it can take 6 or 12 months for a final result to be clear. So if we think about the question I was asked earlier about the swelling after a tummy tuck, if that's going to take 6 to 12 months to fully resolve, then potentially it's going to take 6 to 12 months for the outcome of any surgical procedure to be absolutely final. And in that period, there is always potential for improvement. And to dive in with a surgical revision when a problem may well have resolved itself without surgery is probably not in the patient's best interest. And in those cases, sometimes it is challenging because the doctor wants the best outcome possible, the patient wants the best outcome possible, and we sort of wanted it yesterday. So both doctor and patient need to be patient and see what time can deliver in terms of results. So another question that's been asked is there something that you can use at home to try and improve scars? So we do know that scars are going to be where skin edge has been brought to skin edge, held together with sutures, and then collagen will weld those two edges together. And in the first instance, the body overreacts and puts too much collagen into a healing wound, and all wounds will be red, they'll be thick, they'll feel ropey, and they will continue to put collagen into that wound potentially for the first 3 months. The body then has a process where it sort of realizes that maybe it's overdone the healing process, and then turns around the scarring process, and the scar tends to fade and the scar tends to mature, and the scar will tend to improve, and that process may take out to 12 months. So that there are processes in that early healing phase that can minimize the chances of a keloid scar or a hypertrophic scar and sort of maximize the speed at which you get to the final result. And the things we do know that work are going to be pressure on a scar, massage of a scar, and keeping scars out of the sun. And then one of the ways to put pressure on a scar is going to be simple downward pressure with a form of a tape. And then that tape can be just a paper-based tape, such as micropore, or it can be a silicon-based product, which will just put a downward pressure on scars. And the evidence is there that there is definite benefit for using that in the first 3 months after an operation. And then potentially in different patients, there may be a longer benefit, there may be a greater benefit for using it for a longer period of time. And then those patients are going to be the ones who have shown themselves to be patients who develop a thicker, firmer scar. They're going to be patients with a certain skin type that we know is more prone to scar more densely, and that skin type is going to be a thicker skin type. And classically, they are patients with, a darker hair, darker eyes, and a darker complexion. So then those patients, we definitely encourage them to use some sort of pressure on scars, and often it's in the form of a silicone sheet or a tape for a good 3 months after the operation to make sure they get the best outcome possible. And then they're the ones we're going to be most vigilant about, but it's something that certainly I encourage all of my patients to do, because every patient wants to get the best scar possible. And those interventions are just the little things on top of the surgical procedure to make sure patients are going to get the best result. So there's more to it than just an operation. There's going to be, the consultation process, then there's the considering the options, surgical planning, the surgical procedure. There's going to be the follow-up, the post-op care, and then the long-term outcome. And that really is what surgery is all about. It's not just about an operation. So the question has been asked, a very good question by Shuri, about how long after weight loss surgery, should you consider surgery? So there's been some good research on this, and the suggestion is that you want to be at a stable weight for about 6 months before it's time for surgery. So there are some reasons and rationales behind that, and there are also some exceptions too. So that there's nothing black and white. Everything is. There will be guidelines, there will be recommendations, and then there will be applying those recommendations to specific patients' needs to get them the best outcome. So there is a bit of a feeling that after bariatric surgery for weight loss, patients will have a rapid drop in weight, and they will actually, classically, and the bariatric surgeons have described this extensively, they will drop weight below their ideal weight, and then there'll almost be a rebound effect so that they will almost bottom out and then come up to their stable weight. Now, from our point of view, we're always going to get the best result possible when someone is at their stable weight. So for that reason, the recommendation is we want to see somebody at a stable weight for 6 months before it's time to do surgery. So having said that, there will always be exceptions to the rule. So you'll quite often come across patients who have had weight loss surgery and they've done a fantastic job in losing 50, 60 kilos, but they may be still another 30 kilos short of their ideal weight. Now, those patients are challenged simply by the physicality of their excess skin at this point, so that despite doing an excellent diet and maintaining an excellent exercise program, these patients just hit a wall where they cannot get any further purely because of the mechanical problems the extra skin causes. So those patients are patients where, they're on their weight loss journey, but to continue on their journey, they need to give consideration to weight loss surgery. And asking them to wait until they're at their ideal weight is probably unrealistic. It's very interesting when you talk for 38 minutes straight, but we're going quite well. Thank you for sending in the questions. They're very helpful. I encourage anybody who's listening, take advantage of the opportunity to ask a quick question. I'm just going to quickly grab a cup of water. I've been asked about recovery time for operations as well, so that there's no doubt the more extensive the operation, the more extensive the recovery time. So the body contouring procedures, I seriously think that they excuse me, they'll require a good 4 weeks as a starting point in terms of recovery. That patients are probably then probably looking at 6 weeks before they're starting to return to the gym. In terms of breast and arm surgery, then people will probably need to look at a good 2 weeks. They're not as extensive as the abdominal procedures, but you still need to give respect to the fact that there are wounds that need to heal, and that all surgery is going to create raw surfaces on the inside tissue, and then potentially rubbing a raw surface is like rubbing a blister on your heel, and then that's going to leak fluid, which potentially is going to cause, wound problems and lead to infections and the such. So patients do need to be mindful that what they see on the outside in terms of an incision and a scar is just the tip of the iceberg of the healing process on the inside. So that for upper body contouring, I tend to think it's going to be a week, maybe 2 off work. For abdominal stuff, I think it's going to be 4 weeks and probably 6 weeks before you're back at the gym. I've been asked about arms and arm options, so that arm surgery, is becoming increasingly common. Everyone talks about what bat wings and bingo wings, and it's a lot of fun. But for patients who have these conditions, they are a constant reminder and a constant liability in terms of clothes they can wear, mobility, and they really are a burden. For us surgically, they are maybe not our favoured procedure, simply because from our point of view, it's very difficult to hide the scars and the incisions. So the patients need to be mindful that they are going to be swapping one potential downside for another potential downside. And then the arm operations come in different degrees. So just as we have mini tummy tucks that go to full tummy tucks, extended tummy tucks, we have arm operations that people will call mini arm lifts or mini brachioplasty. We have a brachioplasty, we have an extended brachioplasty, and then we have a procedure that I term an upper body lift. So that a mini arm lift will be trying to take skin out in the armpit and leaving a scar in the armpit. And being mini, it's not nearly as powerful as one where we would maybe take the skin out at the level along the length of the arm, but that's going to leave a longer scar, which is then a downside. So each patient does need to be assessed. For me, arms are more than just arms. They're going to be a case of arms, it's going to be a case of the excess skin on the arm, whether the armpit has fallen out of the armpit and needs to be resuspended, and then whether there's the extra, what women will often call the third boob that's hanging over the top of the bra strap, and whether that needs to be assessed. Quite often in patients who've had a fairly significant weight loss journey, we will have a loss of volume in the breast and descent of the breast tissue, so that the arm operation potentially can lead from the arm down the chest wall and then into the fold under the breast, and we'll do a breast lift or breast reduction at the same time as addressing the excess tissue in the upper arm. And then really it becomes a circumferential upper body procedure, so that it often gets called the upper body lift. And it really is one of those classics of just getting the right procedure to get the patient the right outcome. Now, the length of the scar that goes down the arm, that's a good question, because it's almost like the tummy tuck. If the tummy tuck scar is kept short and we have extra skin on either end of the tummy tuck, then the patient's not going to be happy with the outcome. If the scar from the arm lift comes halfway down the arm, but it then leaves extra tissue down towards the elbow, then the patient's not going to be happy. That was probably not the right procedure to get the outcome the patient wanted. The patient needed to understand beforehand that to get the contour they were looking for, the scar needed to come down to the elbow. So again, it comes down to communication, and then just making sure that the operation that patients get is the one that's going to get them the result that they envisage, giving them the opportunity to assess whether the downside of those scars is going to balance against the upside of losing that extra tissue, and then patients will make an intelligent decision about which operation is going to be the right one for them. Again, that's another one of the arm operations, is another one that potentially, based on the degree of weight loss you have had, is one that is recognised by Medicare as being a functional problem. The functional problem being excess skin, rubbing on excess skin, causing chafing, causing, potential skin breakdown, potential infection, and potential medical problems. So that's a procedure that Medicare will recognise. Similarly, the thigh operations, being a thigh lift on the inner thigh, again, that's one where rubbing on excess skin can cause problems, and that's one that Medicare will again recognise. They recognise it, and the criteria for it are going to be based on the degree of weight loss. So there will be a certain, almost BMI score that patients need to achieve, and that's a reduction in their BMI from their maximum weight to their current weight of greater than 5 to then be eligible for a Medicare rebate and eligible for health fund recognition for those procedures. So really, arm operations, thigh operations, and abdominal operations are dependent on weight loss. Breast operations are dependent on it being a breast reduction, and there are still criteria for breast reductions being performed due to the drop in breast tissue after breastfeeding. And that procedure is a mastopexy, and that is something that Medicare will recognise if you reach certain criteria, and then the criteria for those will be that the nipple is located below the fold underneath the breast, and that the youngest child is over 1 year of age and less than 7 years of age. So that Medicare does recognise those breast lifts, but they're not tied to the weight loss as the abdominal item numbers and Medicare's recognition are. So I'm hoping that it's been helpful for people. It truly is a massive area. There's a massive amount of information out there. There's a lot of misinformation out there as well. So that it really does. The internet's a glorious thing. The internet, I tell everybody, will show you the best and the worst of the world. The problem is that 99% of the population fits somewhere in between, and trying to work out where you sit as a member of the World Wide Web really comes down to asking someone one-on-one if they can offer you an opinion as to what the best options for you are going to be. So that patients really do need to sit down. They really need to get the opinion of someone who has a degree of expertise and a degree of experience. I very, very proudly call myself a plastic surgeon, very proudly fellow of the College of Surgeons, member of the Australian Society of Plastic Surgeons. And my advice is that they're the sort of things that you're going to need to be looking for when you're trying to find a surgeon to offer you, the best results possible. So that the best result possible, it really comes down to, safety, predictability, reliability, integrity. There's a code of ethics that we're asked to adhere to. We take it reasonably seriously. In fact, we take it pretty seriously. So that we're doctors number one. So doctors, rule number one, above all, do no harm. So we have our patient's best interests at heart, and we are committed to get the best results for our patients. And we've put in, those little letters after our name, and we've usually put in many years of training to get to the point where we've reached a standard where the College of Surgeons and the different societies will say, yes, you are of a high enough standard to offer the service that we would regard as being acceptable. And it's a great country, Australia. We've probably got one of the highest standards of care in plastic surgery worldwide. It's well recognised by international surgeons. Australians are extraordinarily well trained and very, very capable surgeons. So that we do live in the lucky country, not only because of the weather and bits and pieces, but because we have a great healthcare system. So that you really just need to make sure that you're in in the hands of a proper surgeon for starters. So Royal Australasian College of Surgeons, FRACS, means that doctor is a specialist surgeon, which is a very important message. If you're looking for plastic surgical procedures, then Australian Society of Plastic Surgeons, the Australian Society of Aesthetic Plastic Surgeons. If the surgeon has an interest in staying up to date with worldwide trends, we're quite often members of, the American Society or International Society of Plastic Surgeons. And these are the sort of questions that patients do need to ask just to make sure that the doctor who's looking after them is up to date on the latest standards of care, does know the latest treatments. And then the other question the patients need to ask is, where's this procedure going to be performed? I mean, in the United States, there's a bit of a trend to performing procedures as day surgery procedures, whereas in Australia we're far more sort of hospital inclined. And the hospitals offer us a degree of, safety. We have operating theatres with anaesthetists, with backup, and it's all about putting the patient in the safest environment possible. So while there may be procedures that are appropriate to be done as day-only procedures, some of the, the larger body contouring operations, certainly not in my eyes, are going to be procedures for day surgery. They're procedures that really need to be in-hospital procedures. And, all of these things go into the whole outcome of your surgical experience. It's not just an operation. It's an operation performed by a surgeon, supported by an anaesthetist who has support and help from expert nursing staff. So really it comes down to finding someone that you feel comfortable with, taking the time to make the right informed decision, and then having that operation performed in a fully accredited facility to make sure you're getting the highest standard of care, and then just knowing that after the surgical procedure, your surgeon is available for follow-up, is available to answer questions. And we're occasionally, we go on holidays. That's all right. We're all entitled to go on holidays. So that we often quite work in groups. So that there'll be, certainly in my practice, there's always going to be a consultant surgeon looking after, holding the fort if I'm not around in town. And that's the sort of service that I think patients should expect, and that's the sort of service that they certainly do deserve. So I think that I've covered a lot of the questions Trish has asked me to cover off. Thank you to the patients who sent in the questions beforehand. Thank you so much to the people who are asking the questions live. If there is anything else I can help with, I'm easily found. Easily found on the net, or by all means drop a line to Trish, Plastic Surgery Hub. She'll be able to put you in touch with me or my practice, and we'll be able to address any other questions that arise. And I just hope that it's been informative. So I will bid people a good, safe evening, and thank you to Trish again for organising something that gives us the opportunity to make sure patients are well informed, which makes us feel patients are making better decisions, which is good for everybody. So thank you. I'd say thank you, everybody. Have a good evening, and I might sign off. Thanks so much for your time.